health and a little wealth and a lot of love.
I would say this is a very controversial topic. We were also listening to that podcast episode with Mark Hyman and Tina Moore, and I can't remember the other person that was talking, and he was the one that was so irate about pediatricians treating obese children with these medications and how it's kind of the standard of care, which I don't necessarily believe that it's the standard of care. But in South Park, Cartman, I think he's 8, 9, 10 years old. He's in elementary school, and they say that insurance won't cover it. And I think part of it is that's true because Ozempic and Manjaro, which are the medications that are more for diabetes treatment, not weight management, they don't have an indication for, I think, treatment for children. But Wegovy, if you are 12 and you meet the criteria for obesity, 12 and above, you're a candidate for Wegovy. And then Saxenda is the other one that has that, meets that FDA criteria. So it is something that can be used in children that are 12 and older, but the question is, should it be used? And I think that there's this misconception that doctors, that pediatricians are out there just pushing medications. I think that there's a lot that they're doing to basically educate family and educate children on how to eat healthier, but the odds are really stacked against them with vending machines and the constant access to these sugary cereals. Right. If you ever watch like Nickelodeon or the Disney Channel and you see how many commercials are for these unhealthy snacks
and food, like I'm telling you, like I don't know about you guys, but growing up, there's all these little things. It's like, I remember this, it was like a ring or whatever, and you take the ring and you take the goo and you put the goo in the damn ring and you lick it and it's really good. It's like sugar on top of sugar. It's like sugar syrup on sugar, you know? And so I know things haven't changed that much. So what is your stance on giving children these medications?
And let me just preface this by saying I am not a pediatrician. I'm an internist and an obesity medicine specialist, and I treat people 18 and older. And I haven't really done any pediatric medicine since med school, but I think that it's definitely a last resort, or it should be a last resort. And I think that there are things that we never thought we would see in children. I mean, the type 2 diabetes we used to think of as adult onset diabetes because it was more lifestyle and it was something that people were getting later in life. But we're seeing it more and more in children, and we're seeing fatty liver disease in children and high cholesterol and all of these high-risk conditions that we never thought we would see in children. And so I think if you've given it a fair shot and you've tried lifestyle for an extended period of time and you're not budging, and sometimes it's educating the family, and sometimes there's only one obese child in the family and the other kids are of normal weight, normal size. And so it's, why do we have to keep the rest of the family from eating this way? And so it's really hard to...
It's very isolating.
Yeah.
So for those kids or, adults who were those children, that can be very isolating and can really create tension and trauma. That's actually really sad. I never really thought about it like that. And so what I'm hearing you say is your stance on this is try everything else first, which is what we believe here. We believe food is medicine and lifestyle choices. Emily is not... I'm not saying she's against Big Pharma, but Big Pharma has its place, and she's not far right, she's not far left, she's big into functional medicine, which is where we're moving in our brand and in this podcast, to be honest. If you've been watching us since the beginning, you've been seeing some of those learnings and trainings and applications that you've been providing in our life and also to your patients, and a huge outcome. But yeah, so your stance is maybe, if you tried everything else, it's worth having that conversation with a pediatrician and understanding what those impacts. Because fatty liver disease, you have to weigh these risks, guys, right?
Yeah, and fatty liver disease, it's not just something that's benign, that's not causing issues. I mean, we've talked about this in prior episodes, but cirrhosis or liver failure, we used to see primarily in people with alcoholism. And now we're seeing cirrhosis, we're seeing liver failure because that's progressed. That fatty liver has progressed over years and years to the point where it's causing scarring and damage of the liver to where the liver can't work anymore. And so it's not something that's not causing issues. And to think of a child in elementary school who already has those signs. I think it's scary. So I think my stance is I would probably pull the trigger with an adult sooner than I would with a child with medication.
With a little health and a little wealth and a lot of love, that's a life that we live, Susan Scruggs.